there are several hurdles, and they are different depending on the patient. One of the things that I think everybody has some difficulty with is having resources to prepare everything that needs to be prepared before the patient leaves the pediatric system. I'm an adult neurologist, so I see the patient after he or she left the pediatric system, but there are lots of things that need to be prepared before they leave, and it is impossible for one person to do everything, so just the pediatric neurologist. So ideally, we would like to have a team of people working together to prepare the patient to leave the pediatric system. The other hurdle we have is that some of the patients have rare childhood onset epilepsies or infancy onset epilepsies that the adult neurologist is not very familiar with. So there might be a little bit of a gap knowledge in terms of this particular rare syndromes, many times genetic syndromes, that the adult neurologist is seeing sometimes for the first time. Really, it needs a village to help one child with epilepsy to become an adult with epilepsy that can reach the maximum potential that this person can. So often we need a social worker, a nurse. Sometimes epilepsy community agencies can help in this process. One thing that is very important from an early age, and we talk about perhaps 12, 13 years, is to promote the patient's independence. So gradually, slowly, you want the patient to learn what medications he takes, what type of epilepsy he or she has, what are the triggers for their seizures. And as the patient is growing older and learns a few steps, you want him or she to learn more things. So how to call when you need a refill, what to do when you need a refill of your medications, who should you call if you're having side effects from the medication. So we want the patient gradually to learn those things that by the time he's at the age of leaving the pediatric system, he or she can manage most of the aspects of his epilepsy. We also want these patients to be screened for psychosocial problems, so depression, anxiety, home environment, issues with school or employment. So we have a few tools to screen these patients, and they have to be, ideally they should be screened by the age of 12, 17, and then again after they leave the pediatric system for about 1 year after they leave, to see if any of those things that perhaps were not picked up earlier or didn't develop earlier are happening after they move to the adult system. So it's important to screen them again for those things.